Putting the I in health IT. Whether you are the doctor or the patient, health information technology or health IT affects you. It is important to understand how the healthcare system is leveraging new technology and life-saving initiatives to change and improve the quality of care delivered throughout the United States. During a catastrophic event or a normal day-to-day life, having a healthcare system that is coordinated and easily transmittable is crucial. Take, for example, the recent hurricane that most of the East Coast experienced. The streets were flooded, houses were destroyed, and thousands were left without electricity. What most people don't realize, however, is how situations like this affect the doctor's offices and hospitals that are expected to treat us. Imagine what would happen if your doctor's office was destroyed in a storm. What happens to your information? How do you make an appointment or refill a prescription? If your doctor is still using paper charts, your entire medical history is now gone. Immunization records, physicals, test results, family history, all destroyed. It is scary to think about, but it is a reality and has happened to countless practices. Without the adoption of health IT, this and other preventable misfortunes will continue to happen. Things such as medication errors due to poor handwriting or misinterpreted prescriptions, severe drug interactions, and compromising security breaches are a daily occurrence and have cost some individuals their life. Fortunately, technology has advanced and electronic health records are replacing their paper counterparts and eliminating these preventable errors, making our healthcare system more efficient and effective. As a patient, it is crucial that your doctor implement and appropriately use electronic health records, otherwise known as EHRs, to securely store all of your information. EHRs are just like paper charts in the sense that they keep all of your health information in one place, but differ in almost every other way. EHRs organize your information in a form or strictly chronological way, meaning that past and current medications are all listed together, test results are together, and so forth. So instead of your doctor looking through years of papers, it can all be found in one simple click. This removes unnecessary or duplicative tasks and also allows for your healthcare information to be easily communicated to other providers who may need access to this information, such as during an emergency situation. EHRs are also useful to eliminate prescription errors, harmful drug or allergy interactions, and most importantly, all data stored in the EHR is backed up, ensuring that your precious health information will never be lost. If we look at the example of Dr. Garcia, he has access to his patient's information even when he cannot get into his office. Successfully implementing an electronic health record is the gateway to all other health IT initiatives. It opens the door to better healthcare delivery, and achieving meaningful use is the next step. Meaningful use means, in simple terms, to use an EHR system in the best way possible. It is essentially a set of rules that doctors must follow. For example, if a doctor sees 10 patients in a day, he or she must record at least 8 patients' height, weight, and blood pressure in the EHR system. If the doctor reports all items appropriately, he or she will attest or pass meaningful use. This is an essential piece for improving our healthcare system because, for the first time, it creates a set of standards that all doctors must follow, which means better care for you and your family. In the case of Dr. Jones, his office has been closed due to the storm. However, because he's a meaningful user, he has electronic access to all the local pharmacies and can quickly send prescription refills for his patients. Another component of EHR adoption and meaningful use achievement is the ability for doctors to send messages to other healthcare providers. These messages are similar to email, but allow for large attachments to be included, such as x-rays, CAT scans, and full patient records. These messages also use special encryption technology to ensure that only the intended recipients receive the message. Health Information Exchange, or HIE, works by connecting various hospitals, creating small networks. The small networks then connect to the state network, and the state network then connects to the national network, or Health Information Network, known as the HIN. The HIEs and HIN allow your doctor to send your information securely to any other doctor in the country. This is useful for John, who was unfortunately planned his vacation during the storm, and is now injured as a result. He has a broken arm and went into shock. He needs immediate care. What the attending doctor does not know, however, is that John has a history of severe allergic reactions to multiple medications. Administering John any of these medications could cause more harm, and with John unable to remember the names of the medications, the doctor is left in the dark. Using the HIE allows the doctor to quickly contact John's family doctor. His patient records can quickly be transmitted, and care can be successfully continued, and any adverse medication reactions can be avoided. Access to the Health Information Exchange can be found in portals or secure online databases that verify healthcare providers' information and credentials to allow for easy exchange of information. NJ-HITEC has a portal that allows doctors and healthcare providers to participate in the HIE or Health Information Exchange, as well as monitor their progress towards meaningful use. Other features of this interactive portal include education and training materials, webcasts and continuing medical education credits, and the ability to chat live with a meaningful use expert. The portal is beneficial to Dr. Smith during the storm because even though she has no power in her office, she can still access all of her most important information regarding her practice and meaningful use progress. Also included in the NJ-HITEC member portal is access to a P2RS data registry. P2RS, or Physician Quality Reporting System, is a repository of de-identified data, or data that is not associated with the patient's personal health information, such as name, social security number, and the like. This data is collected for a variety of health-related measures, such as diabetes, heart conditions, blood pressure, and cancer. The data is then reported to a national database where it is reviewed and will be used to improve the delivery of healthcare in the future. In the example of Dr. Green, we can compare the results of his data collected with his peers to determine the local healthcare needs and trends, making it easier to control and monitor the health of the community. Similar to a doctor's portal, a patient portal allows direct patient-to-doctor interaction. Typically, patient portals are available on the Internet. Some patient portal applications exist as standalone websites or others as applications. They are integrated into the existing website of a doctor or through an EHR system. The central feature that makes any system a patient portal is the ability to expose individual patient health information in a secure manner. Patient portals benefit both patients and doctors by increasing efficiency and productivity by allowing patients to register and complete forms online, schedule appointments, request prescriptions, access medical records, pay bills, and review lab results. Patient portals also typically allow patients to communicate directly with healthcare providers by asking questions, leaving comments, or even sending email messages. For example, during the storm, Rachel's blood pressure spikes and she is unsure how much insulin she should give herself. Having a patient portal allows her to log in and send a message to her doctor, and also review any previous care plans that she may have mentioned what to do if a situation like this should occur. The Personal Health Record, or PHR, works similarly to a patient portal. However, a PHR is only used by the patient, their families, or care providers. PHRs allow a patient to collect, track, and share past and current health information. A PHR can contain an allergy or medication list, family and medical history, X-ray and test results, information about hospital stays, therapy treatments, immunization records, and more. You, as the patient, control what is included in your personal record. Having a PHR helps to organize your health information, making sure all of your healthcare providers have the most accurate and up-to-date information. It also allows you to monitor your own health, set goals, and monitor your diet and exercise. In Susan's case, she's experienced an abnormal spike in her blood pressure reading, and her stress level is very high. She can make a note of these symptoms in her PHR so she remembers to discuss them with her doctor at her next visit. Patient-Centered Medical Home, or PCMH, is a recent healthcare initiative designed to encourage patients to become more involved in their healthcare. It also encourages your family doctor to become more involved in your total care. By establishing a partnership among all of your healthcare providers, including specialists and dentists, will ensure that all healthcare decisions that are made respect you as a patient in terms of your wants, needs, and preferences. It also provides you with education and support needed to make decisions and participate in your own care. A doctor who is a certified PCMH practice will have a nurse practitioner or care coordinator, such as Rose, that follows up with patients that are considered high risk and need reminders to take their medication or who are currently dealing with complex medical issues that may need constant monitoring. By coordinating with all aspects of your care, Rose can help you monitor your care by keeping you out of the emergency room and reduce your overall healthcare costs. And finally, an accountable care organization, or ACO, is a multiple practice initiative, usually centered around a hospital, that monitors, tracks, and records data for high-risk patients that are receiving Medicare reimbursement. By identifying these high-risk patients, the hospital or practice can monitor their care, getting more involved, and encouraging them to adhere to their medication plans, upcoming appointments, and even diet to keep them out of the hospital and reduce the overall cost for the patient, both to themselves and to the hospital. If the practice successfully reduces the overall cost for these identified patients, they will receive reimbursement, and eventually the healthcare cost services will be reduced for all. The healthcare system in the United States is changing, and coordinating care and encouraging you as a patient to become more involved is at the forefront. It is important that healthcare services are made more efficient and can be shared with other healthcare providers. This interoperability is extremely apparent during a natural disaster, like shown here, but it is important that practices are adopted and perfected in day-to-day life. It is time for you to get involved and put the I in health IT.